We have Damaris here today, and she was involved in a car crash, like a whiplash injury, as a passenger, and complaining like shoulder, in the shoulder blade pain, and then up the neck. That was her main areas. We've been doing some massage. We've been doing adjustments and some therapy. And how's it been feeling so far? Better. Yeah, good, very good. And it's been taking some while, but it's definitely feeling better. And we're going to show you what her adjustment looks like today. Okay? All right, come on, lay face down. And it was this right shoulder blade that was really bugging you for a while. That massage really loosened it up. Yeah, it does feel a lot better now. Okay. Yeah, and that rib right in that spot. Okay, so here we go, right? I want you to take a breath and breathe out. Good, okay. I'm gonna tilt your head. I'm gonna check this side here. That side's good, let's try this side. Okay, another breath in, okay? And breathe out. Good, all right. Okay, a little one here. Good, okay. How are we doing? Good. Good, let's lay on your right shoulder for me, okay? Any other plans today?
Just work.
Of course, that's how it goes. Lower back's been doing all right? Mm-hmm. Just a little right there. Okay, we'll take a breath. It's already going. Good. All right. Okay, it's gonna go on the other side. Okay. And this side's better. Good. Okay, you good?
Yeah.
Let's go on your back. Okay, so big hug over here.
Oh, yeah.
There. We're gonna do a little sit up. And then you're gonna lay back. Just breathe. There you go. Okay. Yeah, it's moving really good today. I think the massage really helps.
Mm-hmm.
Okay, a little spot right in that upper part of your neck, okay? Here we go. Good. Okay. Good. All right. Yeah. Okay.
Thank you.
Thank you. How's it feeling?
Good.
Good?
I feel like I can move a lot better now without moving.
Yeah, well, that's really good. And you can go back to work and try not to disturb that, okay?
Yeah.
All right,
Thank
good
you.
seeing you today. You're welcome. So you just saw treatment that we do on patients with a whiplash injury. What you didn't see was that prior to that, we do a thorough examination, x-rays, to properly evaluate what's going on with each patient. If you've been in a car crash or suffering from any kind of whiplash injury, it would be best that you seek a whiplash injury specialist to properly evaluate and give you treatment. I'm going to include a link somewhere below where you could find a whiplash injury specialist in your area. But you don't want to just ignore the pain in your neck or your back because something that can become a chronic issue.